Promise and Rescue have been two fantastic IHI projects that have been really successful by building trust between researchers, public health and pharmaceutical industry. And we have come really a long way by making vaccines and establishing the burden of disease by RSV, both in children and in adults.
I think now the challenge is to get these vaccines into the arms of the babies, both babies within Europe, but also in the arms of babies in low and middle income countries where the majority of the deaths are occurring. I think the other challenge is to try and convince older adults to come forward for vaccination, and this is going to be a challenge particularly in countries in the industrialized world, Europe as well as in the US.
In Rescue and Promise, we have contributed to the development of vaccines. Now we have them and we need to start using them for all children and adults in the entire world.
The data that we've generated as part of the Rescue Consortium and as part of the Promise Consortium have shown what is the disease burden like, particularly in the young children and also in the older adults and also in those with underlying health conditions. And these data are now being used by the National Immunization Advisory Groups, the NITAGs, to inform immunization policies. So these data have been really influential in setting the policy framework both in Europe and also at a global level.
In the past 7 years, we have come a long way. 7 years ago, there was no vaccine available for RSV, and now RSV is a preventable disease. Nevertheless, it doesn't end here. There's still a lot of work that has to be done, and new vaccines are in development, for example, to tackle the burden in the toddler as well.